Equipment Lesson 8 covers grids, construction and selection. Grids are the primary tool for removing scattered radiation from the image after it has already been produced inside the patient. Understanding how grids are built, how they are characterized, which grid to choose for a given clinical situation, what happens when they are used incorrectly, and how to convert technique when the grid changes, all of this is directly tested on the ARRT and used every day. In practice. 13 minutes. Compton scatter is the primary source of image contrast degradation in clinical radiography. When X-rays interact with the patient's tissue through Compton interactions, scatter. Photons travel in all directions, including toward the image receptor. Those photons carry no useful diagnostic information. They add fog, uniform gray overlying the entire image. That reduces the visible difference between adjacent tissues. 3 conditions trigger scatter that is severe enough to require a grid. Part thickness greater than or equal to 10 centimeters. Technique above 60 kVp. Or large field size. Any of these conditions means scatter is significant enough to degrade contrast without grid use. How a grid works. The grid is a flat device placed between the patient and the image receptor. It consists of thin lead strips separated by radiolucent interspaces of aluminum or fiber. The lead strips are aligned toward the X-ray tube focal spot. Primary beam. Photons traveling in a straight line pass through the radiolucent interspaces and reach the receptor. Scatter photons traveling at angles are absorbed by the lead strips before they reach the receptor. More lead strips and taller lead strips equal better scatter cleanup equal higher grid ratio. Walk through the grid cross-section diagram on this slide. Grid ratio equals height of the lead strips divided by the distance between adjacent strips, written as h divided by d. Increasing either the height of the strips or decreasing the distance between them increases the ratio. Common diagnostic ratios: 5:1, 6:1, 8:1, 10:1, 12:1, and 16:1. Higher ratio, better scatter cleanup. More patient dose, more strict alignment requirements. 8:1 is the standard for most general radiography. 12:1 or 16:1 for high scatter work. Grid frequency, the number of lead strips per centimeter or per inch. Low frequency, 25 to 45 lines per centimeter. These grids may show visible grid lines on the image. Distracting but not always a diagnostic failure. High frequency, 60 to 85 lines per centimeter. Grid lines. Invisible on the image. High frequency is required for any stationary grid used in clinical imaging. Moving Bucky grids, oscillation during exposure blurs out the grid lines, lower frequency grids. Acceptable in a moving Bucky. Interspace material. Aluminum is the most common, slight additional filtration effect for grid types with distinct clinical applications. Parallel grid, lead strips run parallel to each other. Not angled. Grid lines at the image edges cut off more primary beam than at the center because the diverging beam strikes the edge strips at an angle. Acceptable at long SID, 72 inches, where beam divergence is minimal. Not suitable for short SID or large field sizes. Focused grid, lead strips angled to match the divergence of the X-ray beam at a specific distance, the focal range. The grid is designed to be used within its labeled focal range. Too close or too far, grid cutoff at the image edges. Most common grid type in diagnostic radiography tables. The Bucky focal range labeled on every focused grid, always check before use. Moving Bucky diaphragm, the Potter-Bucky mechanism. The grid oscillates during exposure. LED strips blur out, grid lines disappear from the image. Standard for table and upright Bucky. Units. Minimum exposure time required, grid must complete its full motion. Very short exposures may show partial grid lines. Stationary grid, does not move. Used for portable and bedside radiography where a Bucky mechanism. The bar chart on this slide shows the Bucky factor, the MAS multiplier, for each grid. Ratio from no grid through 16:1. The bars rise from left to right, 1, 2, 3, 4, 5, 5.5, 6, every step up in grid. Ratio requires more MAS, and therefore more patient dose. Choose the lowest grid ratio that adequately cleans up scatter. For the clinical situation. Grid cutoff, 4 types. Know them all. Off-level cutoff, the grid is tilted relative to the central ray. Uniform density loss across the entire image. Off-center cutoff, the central ray strikes the grid off center laterally. Density loss on one side of the image. Off-focus cutoff, the SID is outside the grids labeled focal range. Density loss at both lateral edges, worse toward the periphery. An upside-down cutoff, a focused grid is placed inverted. LED strips angle away from rather than toward the central ray. Characteristic pattern, severe density loss at both lateral edges with preserved density at the center. This is one of the most commonly tested grid error patterns on the ARRT. Selecting the right grid for each clinical situation. 5:1 or 6:1, pediatric work, portable and mobile radiography. Low Bucky factor, less dose penalty. Acceptable scatter cleanup. For thinner patients. 8:1, the standard for general radiography. Most adult examinations, AP chest, abdomen, pelvis, spine. Adequate scatter control for typical adult anatomy. 10:1 to 12:1, large adult anatomy, obese patients, barium studies, high KVP techniques. Significantly better scatter control for high scatter conditions. 16:1, very high scatter environments. Large patients, fluoroscopy guided procedures, interventional work. No grid, any anatomy less than 10 cm thick. Extremity radiography, small children, tabletop technique. For thin anatomy. Adding a grid to thin anatomy multiplies dose without improving contrast, the tissue simply does not produce enough scatter to justify the Bucky factor penalty. Grid conversion formula, new MAS equals old MAS times new Bucky factor divided by old Bucky factor. For worked examples from the slide. No grid at 10 MAS to 8:1 grid, 10 times 4 divided by 1 equals 40 MAS. For grid artifacts, cause and fix for each. Moire pattern, a wave. Interference pattern across the image. Cause, the grid. Frequency is harmonically related to the detector sampling. Frequency, the two patterns interfere. Also caused by very slow Bucky motion or too short an exposure for the grid to complete its travel. Fix, select a grid with a frequency not harmonically matched to the detector pixel pitch. Verify Bucky motor function for moving grid artifacts. Grid cutoff at the image edges, decreased density at both lateral edges. Cause, focused grid used outside its focal range, most common, or the grid is inverted. Fix, verify. SID is within the grid's labeled focal range. Check grid. Orientation, focused grids have a labeled tube side. Visible grid lines, parallel lines crossing the image. Cause. Stationary grid with low frequency used without a moving mechanism. Expected and acceptable for portable work with low frequency stationary grids. Not acceptable with a Bucky mechanism. Fix, verify Bucky motor is functioning, or use a higher frequency grid for stationary applications. Grid QC and annual inspection. Radiograph the grid with a flat 2 grid performance metrics with clinical relevance. The dual bar chart on this slide shows contrast improvement factor in green and relative patient dose in red across grid. Ratios from no grid through 16:1. The contrast improvement rises from 1.0 with no grid to approximately 3.0 at 16:1. The patient dose rises from 1.0 with no grid to approximately 6.0 at 16:1. The trade-off is clear, every improvement in scatter cleanup comes at a dose cost. Selectivity, the ratio of primary radiation transmitted through the grid to scatter radiation transmitted. Higher selectivity means more scatter is removed relative to primary beam, more efficient grid. Selectivity increases with higher grid ratio, thinner lead strips, and lower grid frequency. Contrast improvement factor, K, the ratio of image contrast with the grid to image contrast without it. Typically 1.5 to 3.0 depending on ratio and scatter conditions. This is how much better the image looks with the grid versus without. Primary transmission. 3 grid questions. These are clinical scenarios. Work through the reasoning before the answer appears. The answer is B. The grid was placed upside down, inverted. Decreased density at both lateral edges with preserved density at the center is the classic pattern for an inverted focused grid. When a focused grid is placed upside down, the lead strips angle away from the central ray instead of toward it. Primary beam is absorbed at the edges while passing through the center. The 62-inch SID is within the grid's 40 to 72-inch focal range, so off focus is not the cause. Inverted grid is the answer. The answer is D. 40 MAS, grid conversion formula, new. MAS equals old MAS times new Bucky factor divided by old Bucky factor. The Bucky factor for an 8:1 grid is approximately 4. New MAS equals 10 times 4 divided by 1 equals 40 MAS. This reflects the significant dose increase required when adding a grid. The grid absorbs both scatter and a portion of the primary beam, requiring substantially more radiation output to achieve equivalent detector exposure. The answer is C, a 12:1 ratio. A large adult abdomen is thick, uses high kVp, typically 75 to 85 kVp, and produces significant scatter. An 8:1 ratio provides adequate scatter control for average adult anatomy, but for heavy scatter conditions, large patient, high kVp, large field, a 10:1 or 12:1 ratio provides meaningfully better contrast. A 5:1 ratio is too low. No grid at all would produce severe fog and loss of diagnostic contrast at 20 cm of abdomen thickness. You covered why grids exist and the 3 conditions that require them, the grid cross-section diagram with ratio and frequency explained, all 4 grid types, parallel, focused, moving Bucky and stationary. The Bucky factor chart, all. For cutoff patterns, grid selection rules for each clinical situation, the conversion formula with worked examples, 4. Grid artifacts and their causes, and grid performance metrics. Including selectivity and contrast improvement factor. Know the formulas. Know the cutoff patterns. Know when to use a grid and when not to.